Fleck is, what are the recommendations and the risks associated with vaccinations? All this stuff we're hearing today about these mumps, those big lumps on your neck.
Oh, is that all? Just all vaccinations in general? Okay, so yes, there's a lot of controversy out there. No, I don't want to get into too much of that, but what I will say is this. You're seeing a lot of news right now in regards to a lot of things going on, whether it be down in Franklin County where there's 300 cases of mumps going on, whether you hear about possible mumps going on up here in Ashtabula County. So the last I had heard, so here's the thing is, mumps, one of the things commonly seen with mumps is inflammation of your parotid glands up here, and there's a lot of different viruses and things that can cause parotitis. One of them is mumps. I usually see about 8 to 10 kids a year who get some involvement of the parotid gland, and I'll check a mumps just to see if anything's going on, and usually it's negative. But that being said, with everything going on down in Franklin County, there's a higher index of suspicion, so they're checking for that. Do I think they necessarily needed to sound the alarms yet? I don't know, we'll see. But the good news is so far that looks okay. But not just that, you look around, you see a lot of other things going on right now. There was a case of diphtheria in Southern Ohio. Pertussis, we see cases of, just a couple of years ago, I had an infant with pertussis who was hospitalized at one of the local hospitals for over a month because, for you and me, it's a nagging cough, but for the babies, they stop breathing, and it's a big deal. So you may even hear that now. One of the things is everybody gets their tetanus shot every 5 to 10 years, and they're talking to you about pertussis and putting pertussis back in the tetanus vaccine. The reason that is so you're not giving it to the younger children. They're finding that older adults and adolescents are passing this back and forth, and it's one reason why we've seen one of the surge. The other reason is there's a lot of misinformation out there about vaccinations. Probably the biggest one, and it's clear to my heart because I have 3 kids. My youngest, my 6-year-old, is a nonverbal autistic on the spectrum. So when you mentioned that big long list of stuff, I have interest in it because I have kids with these issues, and I deal with these issues as a parent every day. So I have an autistic son, I have a son with ADHD, so I can offer, as a parent and a doctor, some information on that. But when it comes to autism, there's no link between vaccines and autism, period. And when you have your child has autism, you want to, blame this, that, or the other, and you want to find some reason for it. And I feel very comfortable telling my patients that I don't think that's the case, but I'm also very flexible in terms of working with them on that. But the big thing we're seeing is what's the reason for this big surge? Why are we seeing this here or there? Dr. Frank Esper, one of the pediatric infectious disease doctors, was on. You can check the news. He's been on there multiple channels talking about it. There's a lot of international travel, people who have not been vaccinated, especially for things like sporting events and other stuff like that, where they see surges of all these vaccine-preventable diseases. And we're seeing it happen, and then we're also seeing a lot of other populations that are not vaccinating their kids. So it's kind of a hotbed for stuff to, especially like OSU down in Columbus, you see the, mumps just kind of like a flame, and it was all over the place. So that was a short answer.
What about HPV?
HPV, yes, Gardasil. A lot of misinformation about Gardasil. So Gardasil, HPV, human papillomavirus. One of the things that pediatricians are starting to talk to families about is giving them, it's similar to the hepatitis B series, there's a series of 3 vaccinations for that. And basically it helps prevent a lot of the known viral types that are predisposing types to a lot of cancers, whether it be cervical cancers in women, girls and women, or oral and cancers down below in boys. People are shocked that boys get the vaccine and girls both do. It also helps prevent many wart-causing types of that particular virus as well. I had someone come in yesterday and they said, hey, why would I give a vaccine that causes cancer? And I'm like, whoa, hold on a second. I wouldn't be a good doctor if I was giving you a cancer-causing vaccine. You have to, that's a layer of trust to say, you can trust me to tell you that if there was something going on like that, I probably wouldn't be giving you that vaccine. But the key is for any physician, pediatrician, family medicine doctor, primary care specialist, whatever, it's good to always have the discussion about it, just to say what's out there. For that mother yesterday, I said, here's all the information about the vaccine. This is what I know. If you have further questions, call me. We'll figure it out. The reason why we want young kids to get it, so this is the one thing I want you to get out of this whole Gardasil thing, is that the vaccine works better. So if we give it between ages 11 to 15, you're more likely to have a positive response, a good immune response to that, as opposed to if we were to do it later. If we haven't had it, yes, we give it later, but if we get it early enough, a lot of times it's more helpful, more useful, and it saves a lot of lives.
You talk about hip fractures. What's the recovery time for patients that come in and have the surgical procedures?
Well, the answer to that, of course, is it's quite varied. The hip fracture is quite a major event in an elderly person's life. Largest bone in the body, takes a lot of energy to heal. And one of our goals as a treating surgeon is to get that hip fracture fixed promptly. Many times, people who have a hip fracture have some other diseases, heart and lung disease, for example, and the longer they stay in bed in the hospital, the more problems they start to have. One of our goals is to get that fracture fixed, get them out of bed and at least to a sitting position and get them moving as quickly as possible.
We have some patients who, when they take that drug, the first time, or when they use a drug like heroin, or any drug like an opiate, their brain lights up like a Christmas tree. Their brain says to them, I've been missing this all my life. I've never felt this good in my life. Why didn't I ever feel this way? And this is the genetic effect of the drug on their brain. They are wired that way. They were born that way, they're wired away. Just like alcoholism. Some people can drink some drinks, and some people can drink cans of dry, the entire country, because it's genetically wired into their brain. So at that point, you have somebody who's addicted to a drug, be it heroin, however they got there, they're going to be on the street because they have to get a drug, because there's limits to the amount of drugs that doctors give you because they're appropriately treating you. But when your brain says, I want more and more, where are you going to get that drug? Well, now you're dealing in illegal activity. You're going to have to go on the street to get the drug because you have to keep the cycle going. Why do I have to keep the cycle going? Because I don't want to go into acute withdrawal. What is acute withdrawal to a heroin addict is the worst withdrawal flu they've ever had in their life. They don't want to go into it. They said, this is the worst feeling I've ever had. And they say, I want to quit, but I keep using just to stay normal. I'm not using to get high anymore because my tolerance is up. I'm using to stay normal. So they're using the heroin every day, every day, every day. This is going on all over the country. No matter how they started, if they ended up there, once they start on the heroin, then they're going to keep using until they get to the point where they have to go through withdrawal.
Explain to me why blood pressure varies.
Well, so the blood pressure is one of the body's ways of getting the blood up into your brain and into the important muscles of your body. And so when you're under stress or anxiety or seeing lots of doctors threatening you with needles, it tends to bring people's blood pressure up. And so a small jump like the one that you described would be completely expected. I have, especially some of my middle-aged men who come into my office are the ones with the sky-high blood pressures that after a few minutes of talking to them, we get that blood pressure down a little bit. But so it's typical to have some variation. When you're up walking around, I'm sure your blood pressure goes up, and when you're asleep in bed at night, your blood pressure can probably come down. And it's just your body's adaptation to how much pressure you need to get the blood where it needs to be.